The COVID-19 pandemic, originated in China, has negatively affected the lives of millions of people worldwide, causing the development of health issues, death, and general havoc. It is no secret that nurses were the frontline heroes and heroines during this devastating period because despite being faced with adversities, they somehow managed to carry out their duties like the true heroes they are. This presentation will argue the three claims, explore counter-arguments, and refutation to help you understand how poorly nurses were treated during the pandemic. Nurses were treated poorly by management during the COVID-19 pandemic because they oftentimes complain about being mistreated, leave the profession, or complain bitterly about burnout. Nurses oftentimes complain about being mistreated in the workplace by their managers, as during the COVID-19 pandemic, staff nurses experienced unfair nurse to patient ratios, had to work with limited protective equipment, and they were not adequately compensated for their efforts. According to Zhang et al. In 2021, a research done with a group of nurses at a hospital in China found that nurses suffered from workplace violence that was directly inflicted and created by the actions or lack thereof of their managers. With the aforementioned, Hong et al. In 2024 posited that nurses would develop mental health disorders such as anxiety and depression due to being overworked or bullied by their managers. Nurses then opted to change their profession from nursing to non-nursing professions to maintain their sanity. Lau et al. In 2023 found that bullying from nurse managers have forced nurses to leave the profession worldwide to seek more fulfilling non-nursing jobs that are less abusive and stressful. A study done by Hong et al. In 2024 revealed that switching to non-nursing professions helped nurses to drastically retain their identities and their symptoms of depression and anxiety were alleviated. The impact of being poorly treated by managers negatively affected the mental and physical health of the nurses in such a way that it causes dissatisfaction in the workplace, leading them to resign. Nurses complained bitterly about burnout from the increased workloads that was inflicted during the pandemic of their workplace. G et al. In 2023 found that they were forced to have extreme workload due to overcrowding with patients that led to extreme stress and in turn exhaustion and burnout. Inadequate staffing forced nurses to work long additional shifts, even in unfavorable working conditions, because if they didn't, they would have been penalized. According to Pirino et al. In 2023, poor remuneration, such as lack of hazard pay, forced nurses to seek additional shifts to gain more income in order to improve their way of life. Despite nurses complaining about their managers, the managers themselves complained about the pressure they had faced to adequately staff the units and direct bullying from direct frontline nurses. According to Liao et al. In 2023, their study revealed that nurse managers have an overall moderately good caring behavior towards their nurses and put things in place to ensure their well-being. However, according to IDOGDO 2023, the nurse managers themselves faced adversity during the pandemic as their roles were either expanded or changed based on the workplace demands and also impacted their physical and mental health. This would lead us to wonder, were the nurse managers sour grapes because during the pandemic, leading them to treat the nurses poorly? However, why were the nurses complaining about being mistreated by their managers? If their managers were caring and had similar experiences as them, why would the managers complain if they have power to create more favorable working environments by hiring more nurses, advocating for more favorable remuneration packages for their nurses, and the authority to discipline their staff if they thought it was necessary? A study done by Perina et al. In 2023 and Lambrog 2024 found that managers need to implement policies and strategies that would improve the working conditions of nurses. Perina et al. In 2023 and Tan et al. In 2023 also highlighted that the nurse managers were more satisfied with their jobs due to their improved remuneration packages, promotion, and work conditions. With that said, I believe that managers should invest in more favorable work environments to increase their nurses' appreciation and in turn decrease nurse turnover rates. Thank you for this opportunity and do enjoy the rest of your evening.